Welcome to episode 1 of Uterine Fibroids. In this episode, we are going to look at definition of uterine fibroids, causes and risk factors of uterine fibroids. We are going to look into details, classification of uterine fibroids and their locations, and finally, we are going to look at typical signs and symptoms geared towards uterine fibroids. In the next episode, we are going to look at diagnosis of uterine fibroids and also how we can manage uterine fibroids. Otherwise, if you are new in this channel, click this notification bell, hit and subscribe, turn it on for the new videos that we will post frequently. Uterine fibroids are benign smooth muscle tumors that normally grows inside the uterus or in the surface of the uterus or outside the uterus or even in the muscles of the uterus, and normally they are benign, meaning they are not cancer causing, and these uterine fibroids normally shrink or even disappear with menopause. Hormone progesterone and estrogen play a significant role in the development of this particular uterine fibroid, and that's why uterine fibroids normally shrink or disappears with menopause. And did you know that uterine fibroid can grow as big as pumpkins, and this one we call giant uterine fibroids, that is the size of pumpkins, and sometimes you can extract a very big uterine fibroid in the size of about 40 kilograms plus, and even the one that was excised and removed via postmortem was almost 140 kilograms, and some were also removed and documented were almost 63.3 kilograms. So we must take these uterine fibroids very serious, particularly in terms of signs and symptoms that we are going to discuss into details. Uterine fibroids has no clear cause, and this is why we do not have a very definitive cause of uterine fibroids. Scientists are working day and night to evaluate what might cause uterine fibroid, but it is postulated that there are some risk factors that are tethered towards the existence of uterine fibroids. And number one in this is obesity. Those who have BMI greater than 30, those who are obese, have a lot of fat cells in their system, and these fat cells are very responsible for development and production of estrogen, and estrogen plays a very significant role in developing and development of uterine fibroids. Another cause or another risk factor is tied towards genetics. It is inherited. It is postulated that if your mother had uterine fibroid, then you as the daughter, you have a risk factor times threefold of you developing uterine fibroids. And it is also documented that it is very prominent in black people or black women than white women. In fact, the risk factors in black women is around 3 to 9 times developing of uterine fibroids. Diet is also playing a very significant role as a risk factor. In fact, those who are lacking vitamin D in their diet or vitamin D deficiency is prone to develop, what we call uterine fibroid. Even those who are using processed food, those who are using red meat, they are prone to develop uterine fibroid. Now, let's look at locations and classifications of uterine fibroids. We must know that this particular uterine fibroids can affect the uterus itself, it can affect the muscles around the uterus, or it can affect intramuscular part of the uterus, or it can affect outside uterus or even towards the cervical area of the female reproductive system. So in classification, we are going to look at 4 major classification and location of this particular uterine fibroids. Now, the number one location that is most common is called intramural fibroids, which normally is located in the muscle walls of the uterus, and majorly it is normally asymptomatic when small in size, but when it grows, it becomes asymptomatic, even causing pressure signs and symptoms that we'll look about. Now, it begins with a small nodule at the uterine muscles, and this may expand inwards, causing distortion and elongation of uterine cavity. Then we have another one that is called subserosal, which is located at the surface of the uterus, or sometimes even outside of the uterine wall, and may grow outwards, and sometimes it might form a narrow stem, and this one we normally term as pedunculated uterine fibroids. And we also have what we call submucosal fibroids, and this is located in the muscle beneath the endometrium and sometimes mid-muscle of the endometrial layer of the uterus, and sometimes this one grows and distorts the uterine cavity, and it is the one which is very, very prone to bleeding and causing infertility, and sometimes it can also be pedunculated. And lastly, in terms of location, we have the cervical fibroids, which are located at the wall of the cervix. And in this particular location, and in terms of growth of these uterine fibroids, they can result into hemorrhage, they can necrose, they can calcify, and even be having some cystic changes. Signs and symptoms of uterine fibroids are very key, and mostly they are asymptomatic. Mostly uterine fibroids are asymptomatic, but you will find that most of them particularly cause pressure signs and symptoms, and when they grow, they result into pain, which might affect this particular patient. And there is dysmenorrhea, that is painful menses. Menses can even be heavy, there can be intramenstrual bleeding, and sometimes can be even spotting. Patient can also present with dyspareunia, that is painful coitus or pain during sex, particularly when the pedunculated uterine fibroid grows towards the vaginal area. And sometimes this one can also distort the abdomen, and abdomen can be very, very distended, and you might think that a female is pregnant. And the pressure symptoms can also result in increased urination, and we find that also 3% of those who have uterine fibroids normally develop infertility. It can also affect pregnancy, and these are the things that somebody or a woman can present with when she is pregnant and having uterine fibroids. One, it can lead to miscarriage, it can lead to prolonged bleeding during pregnancy, and it can also bring what we call premature labor, and also can distort even the position of the child intrauterine. So we take note into that, and signs and symptoms normally worsen as the uterine fibroids grows. In fact, it is more worse when the uterine fibroid is very, very big. As I've told you earlier at the beginning, there are some that has been weighing even 45.5 kilograms, and one that we talked about earlier also about weighing about 63.3 kilograms that was removed in a woman during post-mortem. If you like this channel, please click the notification button, subscribe, turn it on for more videos that we post. For us to understand how endometriosis come about, let us simply know the simple basic anatomy of female reproductive organ. And as you can see into the diagram that I'm presenting here, we have the cervix, we have the uterus, we have the fallopian tube, and we have the ovaries, and of course down there we have the vagina. Now we are going to look at the endometrium. Endometrium is the lining of the uterus, and in this lining of the uterus, the endometrium has muscles that are also supplied with blood vessels. We have what we call strata functionalis, which is the outside part of the endometrium, and strata basalis. Strata functionalis is normally supplied by coiled arteries and spiral arteries, and strata functionalis is also supplied by straight arteries, and these muscles these linings are the one normally being shed, particularly the outside one, that is strata functionalis, is normally being shed during menstrual period. Now, how do endometriosis come about? Endometriosis come about when these tissues that are lining the uterus normally grows outside the uterus. Now, this particular growth can occur in the fallopian tube, can occur in the ovaries, can occur in the ligaments that are holding the uterus, or even outside the uterus. Less common areas are the vagina, the vulva, and the cervix, and it can also affect the gastrointestinal tract, that is the rectum, and also the genitourinary system, the bladder, and the ureters. And rarely can it affect the brains, the lungs, and even the peritoneal tissues. So that is how endometriosis come about. There are causes of endometriosis that we must particularly know in this context, and we find out that there are theories that has been put in place to support these causes of endometriosis. And the opening statement in causes of endometriosis is that the typical causes of endometriosis is unknown, but there are postulated theories that only one has been accepted internationally to be used to verify the cause of endometriosis. Others are just theoretical and has not been proved beyond no reasonable doubt, and researchers are also constantly doing research about the causes of endometriosis. The commonly accepted theory is what we call retrograde menstruation, or transplantation or implantation theory. It is believed that during menstruation there is a retrograde flow. That means there is a blood flow or menstrual flow backwards towards the fallopian tubes and even into the peritoneal tissues, invading even outside the uterus, implanting themselves, growing and forming adhesions. And these particular tissues that now are implanted outside, each and every 1 month when a woman is attending her menses, they also bleed. When they bleed, they result into irritation of the tissues nearby, causing too much chronic pain in this particular context. And each and every month that a woman is menstruating, these particular tissues that are planted outside also do bleed and cause irritation and pain while attending menses. And that is why one of the common signs and symptoms of endometriosis is dysmenorrhea, whereby we will look at during the signs and symptoms when we will be discussing. Now, that is the number one theory that is postulated and accepted internationally, though there are other theories that I'm going to list below, and we are not going to look at details on these particular theories because they have not been proved beyond no reasonable doubt. Research is going on in these particular theories are vascular dissemination, environmental toxins like nickel, mullerianosis, vasculogenesis, neural growth theory, autoimmune theory, stem cell theory, oxidative stress theory, and coeloemic metaplasia theory. Those are postulated and they have not been proved beyond no reasonable doubt. Of course, we have risk factors towards this particular endometriosis, and the number one risk factor is genetical, and this one forms a bigger percentage in the risk factors toward the cause of endometriosis. It's believed that when your aunt, your mother, or a relative in the female side had endometriosis, you have 6 times chances of developing this particular disease. And also those who have early menarche, or those who have prolonged menstrual period greater than 7 days, or those who have early menopause can have a chance of developing this particular condition. And even those who are obese and those who are aged over 30 years of age has high chances of developing endometriosis. Signs and symptoms of this particular endometriosis, we are going to categorize them, and we are going to say that there are 4 important Ds that we normally consider. The number 1 D is dysmenorrhea. Dysmenorrhea is painful menses, or when you are attending your menstrual period every month, you feel a lot of pain. I had discussed about causes of dysmenorrhea, both primary and secondary causes, and if you have not watched that particular video on dysmenorrhea, please look it up here. I discussed into details about primary and secondary dysmenorrhea. And now dysmenorrhea is affecting this particular women because of the implantations that have taken place outside the uterus, and when they are attending, this particular tissues also bleed, and as I've said earlier, they also irritate those particular places, and this results into chronic pain that is also referred even to their back. So they will also present with backache, which may be progressing slowly and becoming worse, or even this particular pain while attending menses will start slowly and normally progresses until there is severe pain. They will also present with another D, that is also dysuria, that is pain while urinating, or while voiding, or while micturating. When they are passing urine, they will feel intense pain. Of course, we will rule out if there are other causes of pain. I've discussed about this in urinary tract infections. If you have not watched that my video on UTI, click the link that appear here so that you'll be able to know more about urinary tract infection. So these particular individuals who have this endometriosis will present with pain while passing urine. They will also present with another D, that is called dyspareunia, that is pain while having sex. I had discussed this into details, and I did mention one of the causes of pain while having sex as endometriosis. This is because of these tissues that have been deposited there, causing scar tissues and adhesions, and they bleed, and this one normally result into pain. Another D is dyskinesia. Dyskinesia is a situation whereby when you are passing stool, you feel a lot of pain. Remember, I said earlier in the beginning of this video that these tissues are implanted out of the uterus, and they can affect your rectum and even your colon and even the bladder. So pain while defecating or while passing stool is a very typical signs and symptoms of endometriosis, though there are other causes of pain while passing stool. For example, if you have hemorrhoids or piles, we'll be able to rule out that if you come to the facility. Chronic pain that is not even subsiding with non-steroidal inflammatory drugs, or rather painkillers, is also a typical signs and symptom, and this pain normally disappear when somebody is approaching or passing menopause, because of those hormones, that's the progesterone, is normally going down. So chronic pain is also typical signs and symptoms towards this particular disease. Prolonged menses, or spotting, or intermenstrual bleeding, or bleeding that can occur as much as possible. Meaning bleeding is occurring more than 7 days, and sometimes very heavy, associated with pain, as I've mentioned earlier, is also a very typical sign of this particular endometriosis. So please remember the 4 Ds, and also prolonged menses, and also intermenstrual bleeding plus spotting together with chronic pelvic pain, and this one will typically lead you to this particular problem of endometriosis. Of course, there are other diseases that may mimic endometriosis. In medical terms, we call them differential diagnosis. Differential diagnosis of this particular disease, that is endometriosis. So we may think of other disease like pelvic inflammatory disease that I've discussed, urinary tract infections, ovarian cysts, I've learned even ruptured ectopic pregnancy or even ectopic pregnancy, irritable bowel syndrome or irritable bowel disease can also mimic this type of disease. Even bladder disease, that interstitial cystitis, can also mimic endometriosis. So these are type of diseases that if you come to the facility, will try to rule out whether you actually have endometriosis or you have other disease rather than endometriosis. And even we'll go ahead and do some laboratory investigation that we will talk about shortly. This particular disease can complicate, and this is called complications of endometriosis. And of course, I've discussed infertility as one of the complications resulting into endometriosis when I was discussing infertility in females. Kindly, if you have not watched that video that I discussed about causes of infertility in females, kindly watch that video that appears up here. So infertility is one of the complications that may arise from this particular disease. Of course, we can have what we call chocolate cyst and even ovarian cyst that may rupture, particularly when these tissues grows into the ovary or grows on the surface of the ovary. When it invades the genitourinary system, we can even have blockage of the bladder, and even if it affects the gastrointestinal tract, we can even have the blockage of rectums because of these adhesions that have been formed by the growth of these particular tissues that when they bleed, they irritate and they inflame and they form adhesions, and now they cause blockage at this particular area. And these complications can arise, and that's why we want everyone who is feeling those signs and symptoms to come to the hospital so that we avoid these particular complications. In diagnosis, the gold standard on diagnosis of endometriosis is through laparoscopy, and this one will be performed by a qualified gynecologist, which will do this particular surgical procedure by use of camera to visualize the tubes, to visualize the uterus, to visualize the ovaries, so that they can make a necessary decision to resect or to remove these particular tissues that have been planted outside. So laparoscopy is one of the investigation and even surgical procedure that might be performed in this particular individual. And also we can do a pelvic scan by doing ultrasound or transvaginal ultrasound. Ultrasound may not pick tiny endometrial tissues, but can pick endometrioma, that was the big endometriosis, and this one can even help in managing this particular patient. Of course, we can also do MRI or even CT scan to verify this particular condition. Of course, also we will go ahead and even do urea, creatinine levels to verify whether there is kidney bladder involvement. Also, we can do full blood count to rule out any disease or any anemia that might result in this particular patient. Main goal of management of this particular endometriosis is to deprive the female body from releasing the hormone estrogen, and mostly all drugs that are pegged in this scenario are targeting the release of estrogen's level. They normally reduce the estrogen's levels into your system, and one of them is the normal birth control pills that we normally give. You will give you combined oral contraceptive or progesterone only, so that the level of estrogen's levels to reduce. Of course, we will also go ahead and give the following, that is progesterone, we'll give gonadotrophin releasing hormone modulators that normally reduces estrogen levels. And in the market, we have leoproline and elagolix, and also will also prescribe for you aromatase inhibitors, and this one blocks the formation of estrogen. And we have what we call anastrozole and letrozole in the market. Of course, we'll give you analgesics. We'll give you analgesics for pain, that is non-steroidal inflammatory drugs, for example, brufen, ketoprofen, diclofenac, to relieve you from the particular pain. If the pain is intense, we can even prescribe opioids, and this will be give morphine to relieve this particular patient from the pain. Of course, most people will ask, am I able to conceive? Am I able to get pregnant when I've been diagnosed with endometriosis? Yes, you will be able to conceive, particularly when it has not invaded fallopian tube, it has not invaded the ovaries, and it has not blocked even the fallopian tube, and you will be able to get pregnant, particularly when it is unilateral. And this one you may discuss with your gynecologist to give you a very, very prolonged and elaborative explanation as per why you may not conceive or you may conceive. And remember, endometriosis is one of the causes of infertility. In terms of surgical management, decision will be made after long counseling by the gynecologist whether to remove your uterus, to remove your ovaries, or even fallopian tube. Gynecologists may decide to do what we call TAH, total abdominal hysterectomy, that is removal of the uterus plus fallopian tubes together with the ovaries, or depending on the extent of the damage by endometriosis, a decision shall be made in terms of surgical procedure. Of course, laparoscopy is the gold standard management of this particular problem. It will be the first one to be in the decision making, only if the level of damage exceeds laparoscopy. If you love this channel, please hit the notification bell, rate and subscribe, turn it on for more videos that we post. And for our loyal subscribers, thank you so much, and continue supporting us, and also those who are also constantly supporting this channel via this M-Pesa number or even this PayPal description that we normally post in our description. Thank you so much, and may God bless you. See you in the next video. Muchas gracias.